it comes to mobilizing the foot and ankle, we're going to think about stabilizing one set of bones and then mobilizing on the adjacent set of bones. So to move the tibial talar, okay, joint, to move that segment, we're going to stabilize the tibia so it's easier. We're going to move the talus. So the motions that we've got are going to be anterior to posterior or posterior to anterior. So to do an anterior to posterior, okay, get in, get the leg nice and close to your third hand. Hold on, okay. I'll wait for you to take a while to figure out where your third hand was. Okay, nice and soft, nice and there. Okay. Come in, stabilize the tibia. Don't rip the tibia, just stabilize the tibia. With the web of your thumb and first finger, you're going to put the talus right in here. So it's going to come high up onto the talus, going to connect with the talus here, and we're going to mobilize that way. Okay? So, you're right in here, taking the talus in an anterior to posterior direction. Okay? Pretty straightforward. Typically 3s and 4s, really trying to get this mobilized. Not a lot of grade 1s and 2s done in this position. Okay, so patient in here, nice and close. This feels a lot more stable for your patient than being out here. Because this is all happening. Alright, so get in nice and tight. In there. To go posterior to anterior, drop your anterior hand down onto the tib fib. Posterior hand, then going to take hold of the calcaneus. And this time you're going to go the other way.
You're pushing on the calcaneus.
Yep. Okay? Again, 3s and 4s. Alright?
And is one of those specifically more for dorsiflexion?
Yes.
Plantar flexion is the PA.
Which one is it? So plantar flexion,
Yes.
PA.
Okay.
Dorsiflexion. Okay? All good? Rotations. Medial and lateral rotation of the talus. Same hand position as for the AP. Come in, you're going to get the hold of the talus in here, in between finger and thumb, okay? So you come in the anterior aspect, finger and thumb. Instead of going front to back, we're going to go medial rotation, lateral rotation. Alright? So on the talus, AP, PA, medial rotation, lateral rotation. Gives it that little bit of wiggle. Alright, not a huge amount of motion, but just enough. You can also do rotation of the calcaneus medially and laterally by coming in, stabilizing the talus across the top, across the front, taking hold of the calcaneus and moving it. Alright, so PAs, APs, medial lateral rotation, depending upon which foot direction, that's where the arrow goes. On the talus or on the calcaneus, we also want to do physiological movements. Now physiological movements are your flexion, extension, abduction, adduction. Okay, or in the foot and ankle, plantar flexion, dorsiflexion, inversion and eversion. And with our physiological movements, so let's do plantar flexion first. So what we're looking to do is, we've done our PAs to try and get the accessory, and now we're going to work on trying to get some physiological motion. Okay, and this is physiological because it's within her control, and not just accessory. So we work on grade 2 large amplitude. And grade 4, end of range, small amplitude. So we're trying to get an inflection through our accessories. Take her up, work it here, okay, and then remeasure. So it's a physiological. Okay, 3, large amplitude, and a lot of times with your 3 you're bumping against wherever the stop is, the internal stop. And then with your 4s, small amplitude, okay. Dorsiflexion, grade 3, large amplitude, grade 4, small amplitude. This is a hard one for them to relax with. They tend to try and pull in the dorsiflexion and help you. Okay, so again, we'll have done our APs to try and get that talus going backwards, and then we'll really get in and try and work on getting it to go back. Now you get pushed off a little bit with the gastroc and soleus kicking in. You start to get that stretch reflex going, which you start fighting against you, so just kind of back off a bit, and then gradually build your way down into it. Right? So physiological, plantar flexion, dorsiflexion. Physiological inversion. Going to invert into this position. We do that by flicking. So inversion, you flick toward. Eversion, flick it away. Alright? Again, it's all physiological. She can control all of that motion. But we're trying to get that hand range. Get that old stuck ankle and in there and mobilize it. Okay? Alright, one last thing you can try before we Are we standing? Are we stand up?
On the table.
No. On the floor. Put that one leg up against on the table. No, the foot on this way. So foot flat on the table. Okay, so you get her into a neutral position, nice stable platform, and she can begin to do dorsiflexion using her own body weight. So it's a physiological mobilization. A lot of stress, a lot of force. She can increase or decrease, and do this at home quite a lot. See how much we're getting? Okay? And if you want to, you can come in here and block the talus and really come in and mobilize it at the end. Alright? You can use that physiological. Hold her there. And do your accessory.
So would that be like a 4 plus?
Just a 4. No pluses. Alright. Takes a little bit of force, but you get a lot. I mean, look at how much dorsiflexion. I can't take her manually into that amount of dorsiflexion. She can hold that, and I can mobilize there. Alright, so takes it up another level.